One of the absolute keys to your survival in cancer is to maintain specifically your lymphocytes. Dr. Steve Rallis, and I'm going to talk to you today about recent blog posts that I did on the neutrophil-lymphocyte ratio, but more specifically, I just want to take a couple minutes to discuss lymphocytes. Lymphocytes are the part of your white blood cells, your natural killer cells, your T cells. These are the cells that are killing cancer. When you've seen something about chemotherapy being deleterious to the immune system, it is. We know that. It's myelosuppressive, which means it suppresses the immune system and bone marrow cells. And so your white blood cell count goes down. And this is what becomes that vicious cycle. And this is really why integrative physicians need to work with the standard of care in every single patient care scenario. I can't tell you how important maintaining the neutrophils, but specifically the lymphocytes, are in patient survival. We know that when that ratio of neutrophils to lymphocytes becomes too acute, in other words, as neutrophils go up, lymphocytes go down, which typically happens in advanced metastatic disease, patient deaths also go up. And one of the key critical components is we're monitoring the patients, they're having chemotherapy, their lymphocytes are going down and down and down and down. And we need to do everything in our power without interfering with the standard of care to maintain those lymphocytes. It's the reason why we do things like mistletoe in higher doses. It's the reason why we do high-dose vitamin C or use other therapies or integrative therapies to maintain it. We have to maintain that, and that ratio is critical. One of the things that we think about a lot with our patients is how do we maintain those lymphocytes. So anyway, I wanted to do a deep dive on this and look at some therapies that we use and some of the therapies that even we haven't used. And I talk about this in a blog post. The title of it right now is Neutrophil-to-Lymphocyte Ratio, a Key Predictor of Survival. That's just a total craft title. But it's partly because in my book, I talk about the neutrophil-to-lymphocyte ratio. But really what I'm talking about in this blog post is how to maintain the lymphocytes. And Dr. Pellegrino and I in the clinic were really talking about, so we know that the thymus gland, which is, so if we look at the sternal area right here, and just behind that, the sternum is the thymus gland. Are there ways to mechanically even stimulate it so that we can maintain it? Because again, in some of these really problematic patients, we see it going down and it's almost impossible for us to raise these levels. We have to. We absolutely have to. So again, just to tidy up the neutrophil to lymphocyte ratio, if it's 1 to 2, so if you just take your neutrophils, divide it by your lymphocytes, if that ratio is between 1 and 2, you're in a good position. If it's greater than 3, not so good. Or if it's less than 0.3, 0.4, 0.5, that ratio changes depending on the research that you look at. I think in the book I say 0.7, so I use that reference in this blog post as well. And here's some of the things that I did find that I didn't know, and some of the things that we do know. So high-dose vitamin C seems to support the lymphocyte count. Not exactly sure what the mechanism is there. I'm usually using it to deplete glutathione, weaken the tumor cells prior to chemotherapy or after chemotherapy. Mistletoe therapy, we know we use that in high amounts. D3, very important. We use D3. We check vitamin D3 levels on every single cancer patient, and we don't want it at threshold levels of vitamin D. We want it more at a super physiological level, so it becomes more of an immune support and it can affect those cells. Probiotics, very interesting. We know that the immune system is centered in the gut, so it would make sense that probiotics would also be immune supportive in terms of lymphocyte count in general. Again, we want at least 25 billion species. So I typically use like the HMFs, which are the human microfloras, seem to have pretty good results with that. Thymus gland extract. It's very interesting. So this is a glandular. So same way we would use desiccated thyroid for thyroid disease or desiccated adrenal for adrenal fatigue, you can use desiccated thymus to support the actual glandular component of the thymus gland itself, to support the immune system and to support the neutrophils and the lymphocytes. So I think that's interesting. Astragalus, we've used that again. Astragalus is a very powerful adaptogen, great adaptogen for cancer. Again, need to cross-reference it with certain chemotherapy, so be mindful of that. The pile leaf extract came up in my research. Never used it. So I really can't comment on its clinical efficacy because, again, I don't have any clinical experience using it, but it did come up. Certain diets, whether it's an anti-inflammatory diet, a fasting mimicking diet, or doing intermittent fasting or fasting, all support the immune system. You just need to be careful because, again, the constitutional demands of a cancer patient are different than a 25-year-old Wim Hof devotee that just wants to sort of do a longer fast to boost their immune system. You need to be very, very careful in cancer and closely monitor that CBC count because you're always fighting against anemia and neutropenia. So there you have it. Like I said, I talk about it in the book. I have a blog post that's going to be up. Check this out. This is critical. Maintaining the lymphocyte count is one of the most important keys to survival in cancer care. Check out the blog, send me a message, let me know what you think. Till next time, be well.